Thank you. Now I know who I am. There you go. Welcome. On behalf of Ron Severo and the entire Planning Committee, we would like to welcome you to this workshop. And before we go any further, Ron and I would like to recognize the entire Planning Committee, so would ask you to please stand up so that you can be recognized. They're strategically placed throughout the room. So everybody on the Planning Committee for this workshop, please stand up, and you'll see that there should be somebody at each table to help facilitate discussion and get the conversation rolling. I'd also like to make a few announcements for the benefit of our webcast viewers, that everybody today who wishes to speak or make comments and reflect on discussion, that you use the microphones on your table and press them and speak into them so that our webcast viewers can listen in as well and learn. For those of you joining us for the first time, and for our new members of the Global Forum, I wanted you to know that the forum is comprised of 56 appointed members who are experts and academic experts and health professionals representing 19 different professions from 9 countries. Our guiding principles emphasize engaging students, being person-centered and patient-centered, and creating an environment of learning with and from partners outside the United States. Workshop topics are selected and developed by the forum members, and then an ad hoc planning committee develops and creates an agenda of activities. The planning committee wants you to know that we carefully considered the forum's guiding principles when we designed our discussion topics and breakout sessions over the next 2 days. So the speaker bios, as well as all their slides and presentations, are in the booklets that are in front of you at the tables. And you can write right in those booklets and don't need to take separate notes. So everything is there. You just have to spend some time leafing through it to get oriented. And if you wish to participate in Twitter and tweet about the workshop, our hashtag is posted right there on the slide for you all to get started. So before we dive deep into the session that we've planned, I wanted to give you a contextual or 360-degree overview of the topic to help answer the question, what is high-quality CPD, and does it make sense to support it? This is not the first time that the National Academies of Sciences, Engineering, and Medicine has examined the topic of continuing education, CE, Con Ed, those are both of the words that are used for continuing education, and continuing professional development, or CPD. This topic is of critical importance because a workforce of knowledgeable health professionals is critical to the discovery and application of healthcare practices to prevent disease and promote well-being. Yet, the professional workforce is not consistently prepared to provide high-quality health care and assure patient safety. In 2010, the IOM committee released a report redesigning continuing ed in the health professions, with the conclusion that the current system of continuing ed for health professionals is not working, as there are major flaws in the way CE is conducted, financed, regulated, and evaluated. Con Ed, or CE, is often associated with didactic, teacher-centered learning, with methods such as lectures conducted in traditional settings such as auditoriums, and it's associated with seat time, or continuing education units rather than competency units. The 2010 report concluded that a new comprehensive vision of continuing professional development was needed to ensure that all health professionals engage effectively in a process of lifelong learning aimed at improving patient care and population health. So CPD stretches beyond the classroom to the point of care. It's a more holistic approach and incorporates a broader variety of learning methods and theories than does CE. It's learner-driven. It's tailored to individual needs. It includes such concepts as self-directed learning and practice-based learning, and it teaches both how to identify problems and how to apply solutions. Also in 2015, a forum publication measuring the impact of IPE, reiterated the distinct difference between these two terms. So now that you have a general overview of CPD, let's look more closely at some of the other terms in the title of this workshop. What is a business case? How do we define it? I can promise you that many of us on the planning committee asked this very question again and again to make sure we had a grasp on the terms. In fact, when Patricia asked if I'd be willing to serve as the forum representative as a co-chair on this committee, I responded that I honestly didn't feel I had a command of this subject and that she should ask someone else. But if she wanted somebody that would keep asking questions and making it simpler to understand, I could be the right person for that. So thankfully, Patricia is well-connected and fearless, and she asked experts on this topic to assist in planning and speaking at this workshop, which is why I had everybody stand up on the planning committee, because it was so important. So we have planned 5 interactive sessions that are engaging and reflective for everybody. 4 sessions today and 1 session tomorrow. And the agenda can be found in your booklet on pages 121 to 124 for today, and then the agenda for tomorrow is on the next 2 pages. So I'm going to give you a brief overview, mostly so that the webcast viewers know our timeline and everybody here sort of knows the overall timeline for the next 2 days. In our kickoff session, the first session, our speaker, Elena Karahana from the University of Georgia, Terry School of Business, and moderator Lucy Savitz from Intermountain Healthcare will enlighten us about the key elements of a business case. And there's plenty of time for question and answer. Well, not plenty of time. There will be time for some question and answers after their presentation. Our second session will include 2 presentations, which will be followed by time for table discussion. Our first speaker, Ron Severo with the Uniformed Services University of the Health Sciences, will help define high-value CPD, and our second speaker, Paul Mazmanian from Virginia Commonwealth University School of Medicine, will explore the value proposition of CPD, of high-value CPD. And I want everybody to know that both of these gentlemen were actively involved in the 2010 report that I referred to earlier. Ron served as a reviewer for this report, and Paul served on the planning committee. We're then going to take a 30-minute break around 10:45 and reconvene for session 3 with 3 unique business case presentations. Quality in Healthcare with Lucy Savitz, an innovative high-value CPD initiative in physical therapy with Mark Bowden from the Medical University of South Carolina. Collaboration and coordination in the Medical Respiratory Intensive Care Unit with Amy Dean and Kristen Miller from Virginia Commonwealth University Medical Center. After those presentations and question and answer, we'll break at lunch at 12:15. And we'll reconvene back at 1:15 when we start our 4th session related to elements within and external to a business case with Simon Kitto from the University of Ottawa and Andrew Spiegel from the International Alliance of Patient Organizations. Elena and Lucy are going to then revisit the elements of the business case again for us, because that'll help us stay focused for our breakout sessions in the afternoon. Each of the 4 breakout groups will explore the business case for an investing entity in 4 different areas. And the 4 different areas of investing would be the government, that'll be one breakout group, co-led by Marilyn DeLuca from New York University and Julia Royale, former National Library of Medicine. The second group will be on the workplace, led by Stuart Gilman with Veterans Health Administration and assisted by Lucy Savitz. The third will be professional associations, co-led by Sylvia Rabinet from the University of Puerto Rico and Nova Southeastern, and also co-led with Elena Karahana. And philanthropic organizations partnered with higher education will be our 4th breakout group, with Darlene Curley with the Jonas Center for Nursing and Veterans Healthcare, and assisted by Paul Mazmanian. We will regroup at 4:45 for reflections and adjourn for the day. Tomorrow we'll start promptly at 8 a.m. and adjourn by 11 a.m. The program agenda, I've already told you, can be found on pages 125 to 126. And Malcolm Cox, our beloved co-chair, will moderate a panel on how the business case for high-value CPD might be operationalized for credentialing and accreditation organizations. We have 4 representatives speaking: Neil Harvison from the American Occupational Therapy Association, Kathy Chappell from the Accreditation Program and Institute for Credentialing Research, American Nurse Credentialing Center, David Benton with National Council of State Boards of Nursing, and Kate Regnier with the Accreditation Council for Continuing Medical Education. At 9:30, we're going to have the report back from our breakout groups and hopefully have some innovative elevator pitches presented to us and shared. And this will be followed by our closing session with reflections on the workshop, and Ron will facilitate a discussion on our next steps. So let's begin. And I'm going to hand over the mic in just a moment to Elena and Lucy, but I'd like to give a little more introduction to them. Lucy Savitz is the Assistant VP for Delivery System Science at the Institute for Healthcare Delivery Research at Intermountain Healthcare. She holds a research professor appointment in epidemiology at the University of Utah and is on the IHI faculty for impacting cost and quality. Elena Karahana is the University of Georgia Distinguished Research Professor and Professor of Business at the Terry College of Business. She has also held visiting appointments in Hong Kong, Australia, Singapore, and Italy, and was on the faculty at the University of Cyprus and at Florida State University. Elena is also a senior consultant with Cutter Consortium of Business IT Strategies Practice. Elena will provide us insight into what a business case is with Lucy as the moderator, so they can both respond to all the questions that you'll have, I'm sure, about their presentation. So I'll go ahead and turn the mic on over to you both. Thank you.